Hello there. As you're all aware, my name's Pete Brown and I'm the module leader for Perioperative Practice Year 1 for ODP. And today this little presentation I'm going to be talking about is around the case study component of this module, which is a written assignment. So what I'm going to do is just basically talk through the written assignment and offer a little bit of advice for when it comes to writing your case study. So why a case study? Basically, it's just to show you you're able to integrate practice and theory, identify the holistic perioperative care surrounding a surgical procedure. Holistic, what I mean by holistic is everything involved. And hopefully this will achieve you a nice academic grade for the module. Okay. So, what's the difference between a case study and a case study? Confused? Some of you may have heard about a case study while in university. Case study is very different to a case study. Case study itself is an in-depth exploration of one particular case, situation, or a subject. The purpose of this is just to gain a depth of understanding into issues being investigated. For example, out of 30 surgical procedures, one may be singled out for a case study. Okay? So it's usually a specific patient, usually carried out in nursing training. Case studies themselves can also be found in books or articles. They'll be used as evidence or examples, mostly from a historical standpoint, or to support a discussion. In some cases, case studies can actually be bibliographical. Okay, a case study, what we are going to be concentrating on, is basically an in-depth exploration of one particular procedure. And the purpose of this is just to gain a depth of understanding into that procedure. For a case study, no single case is a subject. And the exploration just relates to evidence-based practice and care given during a typical procedure. So here you can see the differences between both a case study and a case study. With a case study, it's a typical patient, a generic procedure. There's no placement, patient, or operator specific things needed. We can talk about alternative methods and procedures can be offered. This is also not biased towards preference or patient history. It's just basically a typical patient. We base it on an average patient undergoing that procedure. So what we want to do is just explore what is actually done. With the case study, the exploration is what was done. So these are the differences. As I said before, it's usually a specific case. It's placement specific, which we want to avoid. And the rationale should be evidence-based, but it may be biased to preference and patient history. For instance, diabetics, asthmatics, that sort of thing. Within the case study, we're going to be asking for a confidentiality statement, and this basically should identify that this is a typical patient that we're talking about, no specific patient, and that the procedure is generic. Should be no reference to real people, places, or events. Okay. So, for instance, example 1. So it reads, this case study will provide an evidence-based account of the care that would be expected for a typical patient undergoing a tonsillectomy. Now, alternatively, for the purposes of this case study, the rationale will be centered on the care given to a typical adult. So as you can see there, the emphasis is on typical patient. We're not talking about a specific patient, we're just talking about what type of patient and what type of surgery. This is the basis of the study itself. Another example is this case study will document typical care given to an adult patient throughout the perioperative period. The procedure to be discussed is the insertion of grommets, for example. Or for the purpose of this case study, the patient will be, and give a very basic description, as you can see below, a middle-aged adult, teenager, a small baby, or elderly. And that's all we really ask for this case study is a specific patient. For instance, you may want to do a case study on insertion of grommets for a small baby. Okay, so just keep it like that. Keep it very, very typical. I won't expect you to age the patient or even give the patient's weight, that sort of thing. I just want to keep it basic, and as you can see there, pick an age range. Here again, as I was saying before, this is just a typical case that we're talking about. So some of the common errors that can occur when writing is, as you can see here, during the recovery period, the patient became hypotensive. The anaesthetist was informed and prescribed intravenous fluid. So that sort of thing we want to try and avoid. We don't want to talk about specific people. So not the patient or the anaesthetist. We're talking in terms of, as you can see here, instead what we need to put is hypotension due to hypovolemia is a common occurrence. As you can hear, is a common occurrence following procedure. This can often be corrected with the administration of intravenous fluids. So you can see the difference there. We're just talking about what would normally be done, not what has been done. Again, some more common errors. Avoid reference to real people. So as you can see here, the patient had numbness, which was stated to be much worse at night. So that's getting a little bit too specific. So, and it says, according to Green, this is a common symptom with carpal tunnel syndrome. Numbness can also occur during the day without treatment. As you can see there, I want to try and avoid the patient had numbness. We just describe basically that they could present with numbness. So if you see here, it says carpal tunnel syndrome classically presents with symptoms of numbness, particularly at night. However, if left untreated, symptoms can progress and occur during the day. So you can see the difference there. We just basically want to stay away from any specific patients. So how do I write my case study? Okay, as you're all probably aware, this is a 4,000 word assessment written in an essay format. Okay, we need to structure the essay and make it flow well. Okay. Avoid using bullet points or headings. Explore and explain as well as describe. By meaning explore and explain, explore the procedure that you've picked. Okay, explain some of the things why, and just describe the processes. Okay, so as you are aware, I have actually asked everybody to choose a case study. And I usually ask this after your first placement, when you've actually had the time to work in practice and get used to various different disciplines. I know some of you may have worked in anaesthetics, some of you have worked in scrub. This doesn't necessarily mean that's going to cause a problem, as you'll see as I talk a little bit further on. Okay. So first of all, we need to select a procedure. I mean, this could be anything basically that you've done while you've been in practice, or alternatively, it could be a procedure that you've never been involved with. It's entirely up to you. Most people pick a procedure that they've actually been involved with. Some people maybe it's a little bit adventurous. They may feel like there's something that they're quite interested in, so they may pick the procedure on the basis of that to learn a little bit more knowledge and just expand the knowledge. Then you've got to select a typical age group, as I mentioned before, either adult, elderly, pediatric, that sort of thing. The typical care during all stages of the patient's journey related to the age group. So if it's a child, communication may be an issue, where when we're looking after children, you need to be at their level, okay, their level of talking, and include the parents when you're having this discussion, because the parents are quite important, because as you're probably all aware now, it's the parents who have the right of consent. So they're an important part of this case study, especially when it comes, if it's talking about a paediatric case, you may be talking about consent. Well, I'd expect you to talk about consent, actually, yeah. and things like Gillick competence, which is an essential part of the patient pre-assessment, which I'll get to again as we move along. Okay. Ask yourself what anaesthetic is generally used for this procedure. So if it's a local anaesthetic, consider the other aspects of individualised care, say for instance communication with the patient or hand holding. Yeah? So what I would like to find is a procedure that you've picked, typical procedure, typical age group, yeah, the typical care, and what anaesthetic is usually used for the procedure that you've chosen. So say for instance, if you were going to talk about laparoscopic cholecystectomy, then for instance, you would probably be talking about, endotracheal intubation, which is an essential part of laparoscopic work. So basically, once you've decided the basis of your case study, this will then be negotiated with myself, which I've already informed everybody. You can come and see me, book a tutorial, which may be very beneficial. You can send me an email, explain your rationale, why you want to, what your decision is for this procedure, and just tell me a little bit about why you want to do that. Yeah. Be realistic with the decision as well. Try and avoid any major surgery. So I wouldn't expect you to talk about a AAA, which is an emergency situation and there's a lot involved. That sort of thing, major trauma, we need to avoid that. The best thing to do is pick something rather simple, because anything too extensive can cloud your work, and at the end of the day there's actually a lot of areas we need to cover in this 4,000 word essay, so just keep it very simple. What you need to also include in the essay is legal, ethical and professional considerations. I want you to make reference to the Health and Care Professions Council, which is the HCPC, which will eventually be your registering body. What you need to do is look at the standards of conduct, performance and ethics, and the standards of proficiency for ODP. During the case study, I would expect, while making reference to these standards, is to actually quote the standards. So if you were going to, well, I would expect you would use some of the HCP standards in the essay. It's entirely up to you where you want to use these, and you find out where you think it's quite pertinent. Say for instance consent with regards to the HCPC standards. You could talk about that, you could talk about communication, that sort of thing. But if you're going to use the standards, make sure that you quote them and use the number, the standards number with that quote. Also make references to consent, communication, accountability, advocacy, dignity, duty of care, confidentiality. We need to include elements of health and safety where you think is applicable, say for instance moving and handling as an example, and there needs to be an emphasis on the WHO checklist. When is the WHO checklist checked? What area, which part of the surgical procedure will everybody do the WHO checklist? What are the elements of the WHO checklist? Okay. And essentially what I would like you to explain is why we're using the WHO checklist in theatre. It doesn't need to be lengthy, just as long as you have a little bit of an explanation somewhere. When you're actually doing your case study as well, it's essential that you search for government documents in terms of NHS evidence, NICE guidelines, and these are the gold standards of evidence, okay, and these are important to support your discussion. Excuse me. So I would expect to see reference to these documents. Okay, so let's talk about the format of the essay itself, the case study. Suggested format for your introduction. So the introduction doesn't have to be very long, 250 to 300 words. But the things I would expect to be in the introduction is, as I said before, your chosen procedure, the age range you're going to base this on, and you must you must state that the case study will discuss the typical care given. Yeah, remember that, the typical care. I would expect you to reference to include the operating department practitioner or ODP, and in the introduction, just very briefly state the roles that are going to be discussed. Then there's the anatomy and physiology, signs, symptoms, people at risk, and any alternatives. So, say for instance, we're talking about tonsils. We want you to talk about the anatomy and physiology of tonsils. You know, whereabouts they are. What are the signs and symptoms of tonsillitis? Who are the people most at risk? And as we go along in the case study, what alternatives there? But I'll come to that. I mentioned the patient pre-assessment is going to be included, and also the professional, legal, and ethical issues. Just maybe say at the beginning as well that this is, this case study is going to observe confidentiality and consent, and that basically nobody is going to be identified, no place, no trust will be identified. Right at the end of your introduction, just include the chosen reflective model that you're going to use right at the end, which again we'll come to shortly. So these are the things I would like you to include in the introduction. This is just an overview of the discussion. Okay, so the suggested format. Once you've completed your introduction, what I want you to do is discuss the anatomy and physiology, as I said before. Look into the signs and symptoms. Yeah. So again, like I said before, for tonsillectomy, people have to have multiple infections before this surgery is even contemplated. Yeah. Who's the people most at risk? And importantly, if you can, I would like to include any alternative treatments that these patients could have before considering surgery. And this shouldn't be too long, maybe 2 or 3 paragraphs at the very most. And the next part of the essay is the pre-admission. Okay. Now it's important with pre-admission, as ODPs, as theatre staff, the need for baseline observations is quite important, as you're all aware. And it's these baseline observations that we work from when we have a patient in theatre, such as blood pressures, heart rates, are the patients diabetic, that sort of thing. Do they have any allergies? These are all things that are obtained in pre-admission, and this is vital information for the theatre team and ODPs. Okay, all patient information. So this is a very, very important part of the case study, and I would expect this again, maybe 2 or 3 paragraphs. You can be very concise with this. Just going back when I talk about baseline observations, what I would expect as well, don't expect it. What I would like in here is some examples of baseline observations. So say for instance, blood pressures, heart rates, that sort of thing. Yeah. And what I would expect is, if you're going to do an adult, what's the normal baseline observations for an adult? For a pediatric, which are very different, what are the baseline observations? So I would like examples with blood pressure, heart rate, rest rate, that sort of thing. So you need to include them too. Once we've actually got the pre-admission, this is when we start discussing the ODP roles in more depth. So for the anaesthetic role, basically what we're going to talk about is the patient checklist. When you first receive a patient and you're talking to your patient, talk about the checklist. What are the things that are discussed with the patient right from the very beginning? Yeah. Okay. It's also important with the anaesthetic role, you talk about obtaining equipment, setting up the anaesthetic room, preparation for your list for the patient, that sort of thing. Machine checks. I know we've talked about the Association of Anaesthetists for Great Britain and Ireland. There's a great resource for talking about equipment checks, especially anaesthetic machines. I would expect something like that in there as well. Because we're picking a specific procedure, there's going to be a specific anaesthetic or one that's generally used for the procedure that you've chosen. Now, again, as I said before, if we were going to pick laparoscopic cholecystectomy, then the anaesthetic would be endotracheal intubation. If we were going to talk about knee replacement, the anaesthetic could very well be spinal. And it could also be local anaesthetic, which has a little bit more involvement with the anaesthetic ODP, because they will have a little bit more involvement with the patient when they're in theatre, due to the fact that most of the time with local anaesthetics, there's never usually an anaesthetist present. So what I need you to do is explore the anaesthetic and the different types of equipment that's used for that. I don't necessarily want you to talk about setting up lots and lots of equipment that you would do routinely day in, day out. Keep it to that specific procedure if you can. Okay, just talk about the equipment that you would use for that procedure. Yeah. Otherwise, you can generally get lost in loads of dialogue about equipment and things. So just keep it specific. Yeah, talk about the anaesthetic itself. You know, if you're talking about endotracheal intubation, what does the ODP, anaesthetic ODP, do during that? Yeah. What's the anaesthetist looking for? We'll talk about anaesthetic drugs, but I'm going to come to that in a bit anyway. And just the general duties of the anaesthetic ODP during a specific procedure. Yeah. And this, again, you could include the WHO checklist from this point, as this is usually checked as the patient enters the anaesthetic room. So there's plenty there to discuss. Okay. Then the scrub roll and the responsibilities. So with the scrub roll, what I would expect as well is you to talk about infection prevention with regards to the aseptic technique. So a little bit of discussion on the aseptic technique, a little bit on, you know, the prepping and draping of a patient, and more importantly, patient positioning as well. And patient positioning, as you know, is very important with regards to pressure care, that sort of thing. And again, here we would talk about the WHO checklist, because the scrub ODP has a big responsibility during the WHO discussion with regards to patient consent, the checks that are routinely done with the WHO checklist. Right, okay, so that's part of it. The next part is what I will ask you to do. So we're talking about specific procedure. What I want you to do within the scrub roll is not talk about all the instruments. So historically, what some people have done is discuss every instrument in the tray that's used. As we've said before, generally all instrument trays are generic. They have the generic instruments in. So I don't want you to go through the entire tray. What I'm wanting for you for this is to talk about the specific instruments for that procedure. So reverting back to tonsillectomy again, the specific instruments for that. So your Boyle's Davis gag, Draffen rods, that sort of thing. You only need to include 3 or 4 specific instruments for that surgery, and that's all I require. I don't need you to talk right the way through the whole of the operation itself, because in explaining the specific instruments for that surgery, you're already explaining a little bit about the procedure, so you don't need to give big discussion on the actual operation itself. Okay. Other procedures you could talk about, if it was laparoscopic work, you could talk about the equipment you use, such as the laparoscopic instruments, the camera, insufflation, for instance, just as an example. Okay, so they're specific instruments for that procedure. So that's all I'd expect you to do. Avoid too much discussion on the operation. Okay. We have also the circulator role. It's not actually written on here, but I would expect a little bit of discussion on the circulating practitioner, as the circulating practitioner has a very, very important part in the whole of the operation. Yeah, and it's here where the surgical, the scrub ODP and the circulating ODP will work together. Yeah. Scrub ODP is only as good as the circulating ODP. So there's little responsibilities, well, actually a lot of responsibilities that the circulating ODP will have, and one of the important ones is also the surgical counts. So with the surgical counts, I want you to explain why it's done, and a little bit of explanation on, the stages when this will be done. So for instance, at the beginning of the operation, come at the end of the operation and just before closing, that sort of thing. Why are the counts done? So it would expect you to discuss that also. If, for instance, the procedure they've chosen requires biopsies or samples as routine, explain that too. Yeah. By the time you've got to this point, that's quite a lot to discuss. And what I will stress, and I probably keep stressing as well, when we're talking about all three roles, is to keep them equally weighted. What I mean by that is equally weighted is keep them equally weighted. Keep the word count more or less the same with each one. Okay, because what people have a tendency to do when it comes to scrub roll is there's a lot of things involved, and the scrub roll does take over most of the case study, and that's quite easy to do because, as I said before, if you were going to discuss the operation itself, you were going to stretch it out. So just keep it keep them all weighted, equally weighted. Because one of the things that happens there, and I have seen it many times, if it's not equally weighted, poor recovery ODP suffers. Okay, and that'll only end up with 2 or 3 paragraphs because everything else has been taken up with the previous 2 roles. So just bear that in mind. Okay, so because the recovery role is quite a lot involved there as well. And as we're all aware, in anaesthetics, you're working with an anaesthetist. In scrub, you'll be working with a surgeon. In recovery, you have a great deal more autonomy. Okay, you will have medical staff around generally, but you have a lot more autonomy in assessing the patient, making decisions for that patient, and providing care as the patient's coming around from anaesthetic and recovering from their operation. So with the recovery role, what I would expect is just a little bit of discussion on the AVPU, because that is an assessment that we'll always be doing with every patient. The minute we get a patient, we talk to them, and in essence what we're doing is checking for response also. I would like a bit of discussion on the ABCDE. Okay, I want you to explain each one of them, with the recovery role as well, monitoring, basically pain relief, post-operative nausea and vomiting. So I want these things to be explained also. And along with this, I need the assessments that the recovery ODP will use to look after the patient. So, say for instance, we talk about pain. I want you to talk about the assessments that we use to see how much pain a patient's in. So, for instance, the numerical scale 0 to 10, the FLAC scale, or FLAC score even, sorry, that sort of thing. And if you were talking about a paediatric case, maybe it's the Wong-Baker smiley faces that we sometimes use to ascertain if a child's in any pain. Yeah, so there's quite a lot to talk about already. Checking the patient's pressure areas, that sort of thing. So there's actually quite a lot involved with all 3 roles, as you're aware, and there's a lot to talk about, a lot to discuss. At the end of the recovery section, what I would like is a discussion on the discharge criteria. Now, you've been in practice now, so if you next time you go back into practice and you go into recovery bay, or if you're looking at a care plan, there's no specific discharge criteria that I'm after. Generally, they're all the same. So have a look at the care plans in the trust that you're working in. Have a look at the discharge criteria that's at the end of the care plan, at the end of the recovery phase. And that'll give you a little bit of a guide as to how to discuss this. Yeah. So, it's a suggested format for the discussion. Highlight potential problems that may arise, not that have arisen, stress again, that may arise, and suggest options how you could deal with them. What's the reason for surgical counts, for instance? Yeah, as I explained before. So, what are the potential problems if surgical counts aren't done correctly? Discuss possible considerations, i.e., heart or mobility conditions in the elderly, or skin integrity. If you're talking about elderly patients, there's a couple of considerations we need to make when looking after patients. Yeah. Similarly, with anaesthetic role, you could say one of the considerations we need to observe is if anybody has arthritis, rheumatoid arthritis, this could have a major impact on the anaesthetic itself. Yeah. Discuss your actions with a rationale. When you're discussing things, find out why this is done. Be a little bit analytical. Find out why these things are done. Support your discussion with appropriate evidence. I mean appropriate evidence. I would try and avoid too many Google searches, which I've probably already told you before. Is try and look for books, look for articles. Yeah? If you are going to do Google searches, make sure that some of the evidence that you're looking for is peer reviewed. Some people use Google Scholar. And myself, I would probably get into the habit of doing SNAL searches and looking on ProQuest Nursing database. There's plenty on there and quite a lot of information with regards to perioperative care. Get in the habit of looking. Again, there's a lot of perioperative books in the library as well. So try and find appropriate evidence. Maybe not sort of doctor.net, that sort of thing. That's not advisable. And as you're all aware, Wikipedia. Avoid Wikipedia. I don't want anything from there. Okay. As I said before, ensure confidentiality. Don't name the hospital, don't name the surgeon or team members. It's very easy to get into the habit of saying, we did that, and you would do this, and avoid that sort of thing. Just generalize everything. Avoid we and I. Don't use I, because this is just entirely in third person. Yeah. The conclusion itself is more reflection. I'm not asking for a conclusion. The reflection is basically your discussion. So, as I said before, the essay is in the third person. This is where it just changes a little bit. When it comes to your conclusion or your reflection, even, this is where you're going to talk about you. Okay. So what I'm wanting from the reflection is just a discussion on how you felt the case study has informed your practice, right? And this could be whatever you've taken from this, okay? So let's echo the introduction briefly. Talk about it in hindsight. What have you learned? What sort of skills, what knowledge have you learned from from looking into this procedure? You may have been involved in whatever procedure you've chosen as a scrub practitioner, and you may have done this quite a few times. However, you may not have been involved with the procedure that you've chosen in anaesthetics and recovery. So you could maybe write the reflection with regards to, this is an area I've worked in a scrub, but I've therefore not had any involvement with anaesthetics. This has increased my knowledge further. Okay, so that's another angle. Yeah. Okay. Emphasize key points. Reflect on the experience, and more importantly, how would you think this will improve your practice in the future? A lot of people have reflected at the end and said that actually they found out a lot more about this procedure than they ever knew in the first place. So make this personal to you when you come to do your reflection. Make it personal to yourself, and choose a reflective model. Go online, look at Gibbs' reflective model, or look at the Kolb reflective cycle. These are two of the more common reflective models that people use. You may find a different one that suits you. This is entirely up to you. It's your choice. But again, come and see me or talk to me about which reflective model you've chosen, and give me sort of a rationale why you've chosen that. Again, stages in the case study, as I said before, choose the operation, anaesthetic and age group, gather the information, read up well on the subjects. Okay, record it in rough, all the areas that you need to be covered, in a case study. So make an essay plan. Yeah. I myself, if I'm writing an essay, I'll break the whole thing up into chunks of words, and that's how I will write my thing. So I have so many words for this and so many words for that. So as I mentioned before, when it comes to all three roles, allocate a certain amount of words for all three roles, and that again will help keep it equally weighted. Yeah. Research all the pre-operative, intraoperative, and post-operative treatments. Yeah. Yeah. Keep the anaesthetic, scrub, and recovery sections equally weighted. I will say again. Yeah. Organise your information. Examine and write the events in sequence as they occur. This usually helps. Rather than actually, I'm going to write about the recovery area first. Try and write it in sequence. This is usually a best way, because then you can actually think, right, this is what I would do normally during the day. It usually helps if you do that. Yeah. Again, as I said before, find appropriate research to substantiate your inquiry. And there's a lot of people ask, is there a certain amount of references you need to use for your case study? Not particularly, but I wouldn't expect to see anything less than 20. I would like to see quite a bit, but it's not exhaustive. You can use as many references as you want. What I want to see is evidence of you reading around the subject. So for me personally, if I was going to write something like this, I would probably read 40 references or more, but keep it above 20. Yeah. I need you to show, it's not how many references that you've actually used to satisfy the case study. The more the better, really, because that shows a wide reading around the subject. Yeah. Shows you, how much you've inquired into it, how much you've delved into it. So plenty of reading. Yeah. Write up your first draft. Now, it says here, importantly, book a tutorial. I know this little recorded session is a sort of tutorial in one way. For me, it's more of a guide. I would expect everybody to come at least one tutorial, and as you know, I keep saying tutorials. But I would expect everybody at least one, because there's still a bit of negotiation to be done with regards to your case study. Yeah, it's not just right. Okay, that's what I'm going to do. Sequence. There's some areas that you may not be sure about, and this is where I can come in handy to help you, just to talk about, any aspect of your case study. We generally say we'll look at 500 words. It's usually the rule of thumb. If you were going to send me 500 words to look at or bring in, my best suggestion is, which of the 500 words, which part of your case study are you least sure about? Because if there may be a section in the anaesthetic phase, whatever, that you're not altogether certain about if you've not actually been involved in that area. So send me the 500 words in that area. The weakest part, and we'll look at it. We'll definitely book a tutorial. Briefly mentioned this earlier on. So when we're talking about anaesthetics, scrub and recovery, there is a lot of drugs involved in looking after patients. Now you can I want you to mention the drugs that are used routinely. So say, for instance, as I said before, endotracheal intubation, there would be the triad of anaesthesia. And so what I expect is just tell me what the general anaesthetics, the general drugs that are used for that triad, for that specific case. Now, I would try to find the drugs for that specific case from appropriate sources. Try not to avoid asking an anaesthetist, for instance, on drugs that would normally be used for whatever procedure, because anaesthetists do sometimes have their own methods and their own ideas of drugs in some instances. I would try and, if you're going to talk about anything, just keep it specific. Find the information for yourself. All right. Now, when we're talking about the drugs, what I want you to do is whenever you mention a drug, always take it from the British National Formulary, the BNF, and use this as your reference point for all of the drugs. Because in practice, if there was issues where you needed to, find a drug or find out, the contraindications of a drug, the dosages, that sort of thing, the BNF would be your first protocol. So for the case study, anything involved with drugs, use the BNF as your reference point. Okay, and basically, when you include a drug, you only need to give the specific ranges that are stated in the BNF. So you'll see when you open it, and you can quote these. You can get printed versions of the BNF, but you can also get an online version, and this you can get the BNF for adults and the BNF for children. As you can see, I put a couple of little pictures on here of the most up-to-date BNF copies, and yeah, the online version is quite good as well. So just pick a drug, type it in, and it'll give you the dosages. Now, be very careful as well when, say, for instance, you maybe talking about propofol, for instance, just as an example. Be careful when you're reading the BNF. Some of it may say intravenous injection, some may say intravenous infusion. So whichever one, be careful. If the anaesthetist was going to give a bolus of propofol, if via a syringe, manually, it would be intravenous injection. If it's through a syringe driver, intravenous infusion. The reason I'm saying this is because the percentages can be very different. So just be careful when you're reading the BNF and whatever specific drug you need to discuss. An important thing for this as well, as I said earlier on, is don't specify a weight for the patient because this will require a calculation for the drug. So as soon as you mention a patient weight, that's going to make life harder for you. And I'm including the drugs in this. You've not done your pharmacology yet. So this is why I'm saying just don't be specific. Don't include a weight. Just all you need to do is the dosage ranges for adults and pediatrics if needs be. That's all you need. Appendices, you generally don't need an appendix. I mean, I don't personally read them as such. They're not really marked. Well, they aren't marked, and the words aren't included in your word count. These are just a lot of people put appendices in just to back up the discussion. Okay, so this is not marked, and it's not included in your word count. By all means, include one if you really want to. So the presentation, as we've said before, make sure that you read the Teesside University School of Health and Social Care guidelines for presentation. It is also in your module guide, say for instance, 1.5 line spacing, Arial font 12, sort of thing. Yeah, it's highlighted in the module guide. And as I've told you before, you cite them right for your referencing techniques, because this is where we take the Harvard referencing from. This is where we base the referencing techniques. So this is your referencing Bible. You cite them right. I've mentioned it many times before. Yeah. And again, as I said before, you can find this in the Learning Hub at Teesside University Library. And I've added a little link there for you because I'm so kind. Finally, check through the marking criteria and the generic university marking criteria to ensure that you've covered all of it in both. If you've missed out any of the criteria, then unfortunately your work can be deemed as a fail. Yeah. Get your case study proofread. Very important. Get it proofread. If there's somebody in your family who you think maybe could read it, maybe it's one of your friends, take it away. There's getting somebody else to proofread your work can change it quite a lot. Yeah, because we only read what we expect to see. We read what we expect to see, basically. Okay, and generally we do miss things out. So I would strongly suggest a proofread of your case study when you've finished. Take it to the library if you need to. There's invaluable help there, as I have mentioned before, with academic writing. But if you do take it to people in the library, make sure that you take the specific assessment criteria, because they'll be able to translate that and they'll be able to, go through that with you. Your case study will be given an unratified feedback within 4 weeks of submission. So after 4 weeks, once you've submitted it, I'll take it away and mark it, and then I'll bring it back. Okay, so you've got 4 weeks. And I'm quite rigid with that. That will stay at 4 weeks. It won't change. These, when you get your results back, won't be ratified until the assessment board, which could be a month or so after. It could be a couple of months. So if, for instance, you happen to fail or you don't submit, you will have to wait until the board to be given a reassessment date, and this can only happen at the board. Okay, so if you fail or you don't submit, you will probably have to wait a little while before you can even get that opportunity. So just get it done. Again, I keep going on about tutorials. These are very important, and the tutorials can mean the difference in marks, can mean a dramatic difference in marks. Not because I'm happy that you come for a tutorial, just because just a little bit of discussion can actually help, massively. Yeah, you can arrange them, face to face with me, or you can arrange them electronically. Around the time when it comes to your writing your case study, I will put on the intranet tutorial times, which you can see when you go on the intranet on the university site. Whenever I put tutorial times down, I always put the times, and I will let you know. I will email the whole of the class to let you know that I have put tutorials times down, and I will let you know the dates that I've put them down for. It's up to you. You just go online, select a date, select the time, and once you've done that, that'll automatically email me and put it straight into my diary. It's as simple as that. Okay. And I said here before, we're not going to mark the case study at a tutorial. And I said, if you feel there's an area that's weak, just ask me to look through it. I can't read through the whole of your case study, as you're probably aware. Yeah, I'll choose a section and give you advice, but definitely come for a tutorial. So once you've finished your case study, hand it in via electronic submission. This is processes in Blackboard. You already know already. There's electronic submission. So the assessment criteria. So this is 100% the case study. The 4,000 word case study is based on a surgical procedure. It will be assessed using the following criteria. So this is important. This is what you need to cover to get the marks. Right? So the first one is, within the context of a chosen procedure, identify key elements of safe perioperative practice, integrating knowledge and concepts within perioperative care. So this is all the stuff we've discussed basically. You've identified safe perioperative practice, yeah, you've chosen a procedure, and you want to discuss and integrate knowledge and concepts holistically throughout the whole of the perioperative phase. Right? Demonstrate the integration of professional, legal and ethical considerations within perioperative care. As we discussed before, there's loads of elements there that are mentioned with regards to the professional, legal and ethical considerations, such as HCPC, accountability, advocacy, as I mentioned before. I've just discussed as well, demonstrate the key principles related to basic pharmacology encountered in ODP practice. So this is basic pharmacology. As I mentioned before, you haven't done pharmacology module yet. This is just the basic pharmacology that you encounter. So at least you can identify the drugs used in the triad of anesthesia. You can identify maybe local anesthetics that are used for infiltration during the surgery or after. And with recovery, the basic pharmacology, what sort of pain relief is generally used in recovery for patients who've just had surgery? What drugs are routinely used as antiemetics for post-operative nausea and vomiting? That sort of thing. It's just the basics. If you use your BNF, as I mentioned before, you can't fall off. Use that as a reference point and just give the dosage ranges. That's all you need to do. Okay, the next one, demonstrate the ability to engage in reflection on practice using a model of reflection. This, again, it would be handy to come into tutorials just to discuss this. So this is another reason why it's best to come and see me. But engaging in reflection right at the end. This is, as I said before, you're going to be discussing the case study and how this has helped improve your knowledge. Adhere to the School of Health and Social Care policy on confidentiality and consent, which I mentioned before. Always make sure that we're never identifying patients, staff, or trusts. This is just generic. It's just what happens normally, routine care. No identifying anything. Finally, adhere to the School of Health and Social Care guidelines on presentation and referencing. Correct referencing techniques. Make sure, as I said before, you look at the guidelines, cite them right. It tells you exactly how to set out the references. It tells you exactly how to reference in text. If you go through cite them right, you can't fall off. It's concise, and that's what I will be marking from. Yeah, the handing date. The handing date is on the 5th of March 2018. And as I said before, it's via e-submission on Blackboard. Before or on that date. And you've got up to about 4:30 on the 5th of March. So remember, select your case study early. Read, read, read. Start your first draft soon. Yeah, get some ideas. As I said before, structure your essay. You might want to write a little bit on the pre-assessment, a bit on the anatomy and physiology, the anaesthetic role, whatever. Just write that. Try and do it in sequence, as I mentioned before. That usually helps. Book your tutorials. And finally, good luck. And I hope it goes well. It will, because you'll all come and see me. Yeah, great stuff.